Common question that I get here in my office is, doctor, can you remove all the moles that I have in my body so it would reduce the chances of me developing a skin cancer? This is what I'm going to talk about in today's video. Common question that I get here, patient is usually referred to me by a dermatologist to remove a suspicious mole, a suspicious melanocytic nevus that might be a melanoma. And when we're going to do the procedure, he asks, well, can't you just remove all the moles that I have so it would reduce the chances of me developing a skin cancer? Well, yes, it would be a great idea, but we don't do that for two main reasons. The first main reason is that what we're talking about, the type of skin cancer that we're talking about when we're talking about melanocytic nevus is melanoma. So dark moles, dark brown moles that might turn into a melanoma. In the past, we believed that most of melanoma came from a pre-existing nevus, but that's not really true. Studies show that only 25% of melanomas, they come from pre-existing nevus. 75% of the times, melanoma comes from a normal skin area where there was no pre-existing mole. So it might be the case that we remove all the moles of those patients and the melanoma might occur because 75% of the times it arises from normal skin area. So that's the first and main reason. Second reason is that yes, we could remove all the moles if the patient has 5, 10 or 20 moles, but we know that this patient has a really low risk of developing melanoma. The really high risk patient of developing a melanoma is the patient that has more than 100, 200 moles, and it will be impossible to remove all of them. So basically those are the two main reasons. That's why we don't remove all the moles, and we know that that wouldn't reduce the chances of developing a skin cancer. And I'm not even talking about the other types of skin cancer, BCC, SCC, that they don't have anything to do with melanocytic moles or the dark brown moles, nevus that you have. So those are the two main reasons. If you have any questions, please write below. I'll try to answer them. See you next time.